Can triple-negative breast cancer, TNBC, be prevented from spreading? Imagine a type of breast cancer that is particularly aggressive and tricky to treat because it lacks the usual targets like hormone receptors and the HER2 protein. That's what makes triple-negative breast cancer, or TNBC, so challenging. It tends to grow quickly and can spread early, often before symptoms appear. Because of this, preventing its spread is a major focus of current medical strategies, but it's not entirely possible to stop it from metastasizing. The main approach to reducing the risk of TNBC spreading involves systemic treatments that target cancer cells throughout the body. Chemotherapy is the cornerstone because TNBC cells divide rapidly and are more sensitive to these drugs. Often, chemotherapy is given before surgery in a process called neoadjuvant therapy. This helps shrink the tumor and attack microscopic cancer cells that might have already spread. After surgery, additional chemotherapy or radiation therapy can be used to kill any remaining cancer cells and lower the chance of the cancer coming back or spreading further. In recent years, immunotherapy has become an important addition for some patients. Drugs like pembrolizumab help the immune system recognize and attack cancer cells more effectively. These are especially used in early-stage TNBC with a high risk of recurrence or in advanced cases where the cancer expresses specific proteins like PD-L1. Combining immunotherapy with chemotherapy or radiation is an active area of research, aiming to improve control over the disease and prevent spread. Genetic testing also plays a role in managing TNBC. Tests can identify mutations such as BRCA1 or BRCA2, which influence treatment options. For example, PARP inhibitors are targeted drugs that help control cancer in patients with these genetic mutations by exploiting weaknesses in cancer cell DNA repair. Using these targeted therapies can help slow disease progression and reduce the chance of metastasis in selected cases. Radiation therapy is another tool used after surgery. It helps destroy residual cancer cells in the breast or nearby lymph nodes, lowering the risk of local recurrence and possibly distant spread. However, because TNBC is so aggressive, resistance and relapse can still happen, which is why radiation is often combined with systemic treatments like chemotherapy and immunotherapy. While we cannot completely prevent TNBC from spreading due to its biological nature, these treatments are designed to reduce that risk significantly. Ongoing research continues to explore new ways to improve outcomes, including personalized treatment plans tailored to each patient's specific disease characteristics. Patients diagnosed with TNBC should work closely with a team of specialists experienced in this subtype to develop a comprehensive treatment approach. Early and aggressive therapy, along with regular follow-up, is key to managing the risk of metastasis and improving quality of life. Always remember, individual responses vary, so personalized medical advice from your healthcare provider is essential for the best possible care.